Earlier this year, there was this case of a 25-year-old, I believe it was from Beijing or somewhere, where stem cells from her own body was used to regenerate uh, beta cells. So, what is your thoughts on this? Like that, if that really works out, then it's like opens up a lot of possibilities.
It certainly does. So that we have to take a step back. So why and talk about these type of restorative therapies. So in general, when people talk about stem cells, the way they think of them is these cells that are these early undeveloped cells that may have the potential to turn into any tissue. So the initial thought with that is, oh wow, if you have tissues that are damaged or unrecoverable, like in type 1 diabetes where the beta cells are killed, can you use stem cells to redevelop them, regrow them, and then they're functional again? Wouldn't that be amazing? Or let's say someone has damage to a tissue, like let's say individual needs a kidney transplant because their kidneys are lacking function, or tissues within that tissue are so far damaged that are unrecoverable. Could we use stem cells to regrow the or grow back tissues that were being destroyed or are ultimately being damaged over time? That's the potential that stem cells held. Well, this emergent study, it looked at the use of stem cells where not only do you take the stem cells, you didn't need to take them from other individuals. In fact, stem cell therapy was such a controversial thing in the United States because where they were taking them originally was embryonic tissue, because in the embryonic tissue there's very potent, powerful stem cells in embryonic tissue. So fetuses or babies when at birth. But that became very controversial. And how you don't take those from these individuals, or it became a political issue. And so that actually forced scientists through because of policy barriers to look a different direction. And so what they looked at was the ability to take tissues from or cells from tissues like fat, and actually used certain chemical molecules in a laboratory setting to take fat and then cause the fat to almost have stem cell like properties. And that allowed for these tissues that you can easily take. People do take fat tissue or other tissues all the time in laboratory settings. If you could take that tissue, turn it into a stem cell, is there the possibility that we don't need to take tissues from things like fetuses or babies, and it comes from the individual themselves, and then utilize that to regrow tissues in that person? And the answer to that in this case report, was yes. What they did is they were able to take fat cells, put them in a laboratory environment, turn them into stem cells, utilizing a very unique method. They were then taking those stem cells and turning them into beta cells that produced insulin, because in type 1 diabetes, your beta cells are destroyed and or gone. So you don't have the ability to automatically regulate insulin anymore. And so then they take those beta cells and were able to transplant them into an individual. And they use a very unique transplantation site, because depending on where you put these cells, they appear to be more or less effective. So they put them in the area, the lower abdomen in this case, and they found that utilizing this unique chemical or this unique extraction technique from a person, then a unique chemical and induction of stem cells, and then unique ability to turn it into beta cells, and the unique injection site actually allowed for a person to get completely off insulin and essentially become as if they didn't have diabetes at all. And so this is a rather remarkable advancement in general. But is that going to be the cure? Does that mean that me, Andrew Kudnick, is going to no longer have type 1 diabetes in such a short period of time? Or that Johnny or Jim or Angela, or whoever it might be, who just got diagnosed, are they going to have to not worry about their diabetes in this case, or type 1 diabetes? Unfortunately, the answer to that is no, because they've actually been studying stem cells and curative therapies for decades. And the biggest reason, in fact, there's a paper in the year 2000 that quite literally changed the entire field of type 1 diabetes, because they showed that they were able to take islet cells, transplant them, and achieve completely normal glycemic control. That revolutionized the field. It revolutionized at the thought process of getting this disease is that, you know what, here soon you're going to have a cure, so don't worry. Did that happen? No. Here we are 24 years later, almost 25 years later, and we don't have a cure. In fact, the best we have is preventative therapies that may delay the onset by up to 2 years. But you'll eventually still get the disease. And the reason for that at its core is that in this specific case, and in many cases where tissues are damaged, the immune system actually has changed. And that immune system change